Given the weakness of the signals that we are trying to measure, it is crucial to have as low impedance as possible. The red, white, and black electrodes form an ingenious system for noise reduction called common mode rejection, or CMR. This method requires that the impedance difference between the electrodes is as small as possible. An ABR cannot be performed if the impedance via the red and white electrode exceeds 12 kiloohms, and the impedance difference must not exceed 4 kiloohms. Before the ABR test can proceed, the Accuscreen measures these important variables. Depending on your setup, the ABR test can start automatically when the values are within the limits, or you may have to press the start button manually to begin the test. If the system reports too high impedance values, measures must be taken to try to reduce the impedance before any test can be performed. Check if the baby's skin is very dry. Also, check if the electrodes are dried out or very old. Electrodes have a limited lifetime, even if they are stored properly. Check if all electrodes adhere well to the baby's skin. If not, you may have to remove the electrodes, re-prep the baby's skin, and use new electrodes. Do not use the previous electrodes, since these probably have limited adhesion since they have been attached to the baby's skin once. Finally, check and make sure the electrode cable clips are firmly attached to the electrode and that the metal on the electrode clips is not corroded and is free of debris. Noise is a common problem when working with hearing screening. In the world of hearing screening, there are three major noise types: acoustic noise, electrical noise, and myogenic noise. Acoustic noise is basically unwanted background sounds such as crying babies, chatter, ventilation noise, or beeping or buzzing equipment. Electrical noise may stem from, for example, cell phones, electrical equipment such as TV monitors, or fluorescent tubes. Myogenic noise is actually a special case of electrical noise that originates from muscle tension. All of these sources contribute to the total noise level in the measurement, and you should consider all of these when screening infants. Ask the people present to refrain from talking during the measurement and tell them to switch off all cell phones. If possible, perform the measurement away from noise sources such as ventilation ducts, buzzing or beeping computers, or other medical equipment. Also, close all open windows. To minimize myogenic noise, the baby should preferably be asleep. It helps if the baby has been fed recently. Remember that sucking on a pacifier generates a lot of myogenic noise. The test may take longer if the baby is restless, and this may result in a false refer. To start the test, begin by pressing the Find Patient icon on the Accuscreen home screen. Click the patient of your choice. Check to make sure that is the patient you wish to test. Then press the check mark on the patient details screen. This will take you to the test menu. Choose what test to perform from the test menu. Press the corresponding button for the test type and the ear you wish to test, be it left or right. When using ear hugs, the system also offers you the possibility to test binaurally. The icon on the button indicates whether this test has been performed previously and the status of that previous test. A green check mark indicates a pass, a red cross indicates a refer, and an encircled question mark indicates an incomplete test, for example, a test that was aborted by the user. The play symbol indicates that this test on this ear has not been performed earlier. When you start the test, Accuscreen will check that the prerequisites for testing are fulfilled. The impedance for the nape as well as for the forehead is measured. This value must be below 12 kiloohms for the test to pass. The balance must be below 4 kiloohms. Depending on how you have set up the Accuscreen and Acculink, the test will start automatically when the impedance values reach the desired levels, or you will have to press the play button manually in the lower right corner of the screen. During testing, you will see some information about the test. The ABR appears in the upper part of the screen. The green rectangle indicates the portion of the ABR that is monitored. Below the ABR, the white and red electrodes impedances are displayed. The ABR bar shows the amount of ABR data collected. This bar will grow progressively as more and more data is collected and an increasingly stable statistical measure is calculated. Note that this bar may also decrease if a lot of noise is present during the test. The EEG bar indicates the electrical noise level in the data. For example, myogenic noise should be as low as possible. The blue bar, progress, indicates the overall progress of the measurement, but it is not a measurement of time. Instead, it will progress rapidly if a high quality of data, that is, with low noise, is collected. It will progress very slowly if a low quality of data, that is, with a lot of noise, is collected. You can view the ABR test as a race between the green and the blue bar. If the green ABR bar reaches its endpoint before the progress bar, a pass will be issued. Otherwise, a refer will be issued. On rare occasions, the device determines that a pass will not be possible because the ABR is so weak or the noise level is too high. When this occurs, the Accuscreen will stop the test before the blue bar has reached its endpoint. This is called a fast refer, and may, under poor test conditions, occur quite fast after the test starts. The result of the ABR test displays clearly as a pass or a refer. Alternatively, the screening program at hand uses the terms clear response and no clear response. Along with this, you can also see the overall EEG level, the impedances, and buttons to add comments and print the test. To return to the test screen, press the check mark. After the test, detach the electrode cable clips from the electrodes as shown. Gently remove the electrodes and ear hugs from the baby's skin. If you have difficulty removing the electrodes or the ear hugs, then use a damp cotton swab to loosen the adhesive gel from the skin by gently wiping. When you remove the ear coupler cable transducers from the ear hugs, be careful not to pull the cable. Doing so repeatedly may damage the cable over time. Instead, grab the transducer itself with one hand and the ear hugs with the other and separate the two. While Accuscreen cables are durable and built to withstand normal daily use, they do contain delicate components such as calibrated speakers and data memories that can be damaged if mishandled. Treat them with care and they will last longer. If you are using the probe for ABR testing, pull out the probe from the pina, remove the ear tip from the probe, and be sure to check for debris or earwax in the probe tip canals. The ear tips are single-use disposables and should only be used once.